Thank you, and thank you for the kind introduction, and thank you, Laura, for introducing already my role and setting the expectations higher than I would have liked to do it myself. So thank you for inviting me to the event today and to give me the opportunity to update you on air quality policy in the European Union. I would like to use the next 18, maybe 20 minutes to take us on a brief journey to reflect on why we still consider air pollution to be a key environmental challenge despite progresses, how clean air policies have tackled this long-standing challenge, and how we're now updating our policy and what we're expecting to achieve by doing so. So diving into my talk, I would like to start off with a number. The number is 253,000. Laura already mentioned this. This is the number of premature deaths attributable to air pollution by fine particulate matter in the European Union in the year 2021. This is an estimate that comes from the European Environment Agency, and this is based on epidemiological-based health impact assessments on an annual basis. And you heard the number broken down for Ireland mentioned before. It is a really big number, which still makes air pollution the most impactful environmental challenge. But it's important to look at it in a context. Over the past 2 decades, this number has decreased by 41%. And we are well on track to the target that we set in the Zero Pollution Action Plan in 2021 to reduce this number by 55% compared to 2005 by the year 2030. In the same period, we've reduced the emissions of air emissions across the EU by 80% for sulfur dioxide, 27% for fine particles, and for 12% for ammonia. All of this while the gross domestic product, so our economy, has continued to increase, in this case by more than 13%. This goes to show that the reduction of air pollution does not come at the expense of our economy. Quite the contrary, as I will show later on. So in short, I think the question raised by the slide, does EU clean air policy work, is a yes. It is important to stress this, as achieving these downward trends requires efforts at European, national, regional, and local level. We all know this. It is not easy to do the work we do, but it is good to realize that these efforts actually deliver. It may be useful in that context to remind ourselves just how EU clean air policy works. Early EU policy interventions date back to the 1980s and expanded especially during the 1990s and the 2000s. These interventions comprise 3 pillars. The first one is the Ambient Air Quality Directive, or the CAFE Directive as you've been referring to it, which sets maximum concentration levels, but also establishes how and where we measure. The second important element is the National Emission Reduction Commitment Directives, or the NEC Directive, which sets national emission totals for 5 of the air pollutants. And the third element is that we have source-specific emission standards set in bespoke legislation to address the key sources of air pollution to reduce the pollution per unit of activity. In combination, these 3 policies have delivered successes. But, and this is the important bit that I don't want to leave out, we still are not at a situation where air pollution no longer poses a problem. So we are nowhere near done. In my previous slide, I've referred to the significant number of premature deaths, but increased mortality is not the only health impact we have. Laura mentioned the other morbidity effects in her introduction. The World Health Organization estimates that 17% of the lung cancer cases in Europe are still due to air pollution. This brings with it also social impacts, as we often see air pollution to disproportionately affect vulnerable groups in society: children, elderly, people with pre-existing conditions, but also the socio-economically disadvantaged. Beyond the health aspects, air pollution today still causes eutrophication and even acidification of ecosystems, including crop damage. This all translates into a rather significant economic impact. We've estimated this to be in the order of magnitude of 230 to 850 billion euros per year. And this range is big because it depends on how you choose to assess the value of human life. There are different methods. They're all credible. If we just look at the lower range of this estimate at 230 billion, this is a rather big number. It's maybe useful to also pause a second and have a look on where air pollution is a problem in particular. This figure summarizes the EEA report in just 2 graphs, and it's complicated, so I want to walk you through it very briefly. On the left-hand side, you see a map with the measurement data, the sampling points we have. Everything that is above red is above the current EU limit value. Everything that's above blue, so yellow and orange, is above the future limit value that I will be talking about in a second. So you see there are dots all over. On the right-hand side, you see the entirety of the monitoring results. This graph is complicated. It shows per member state the monitored data, the highest and the lowest signified by the bars, and the blue in the middle shows you where the light blue and the dark blue meet is where the median in a country lies. You can see Ireland is at the left side of the graph, which means it is better off than many of the other countries in Europe. However, you can still, by the size of the bar going up, that there are still some locations where there is a level that is above the future limit. I've got another graph of a similar nature here, this time for NO2. You see here that the picture is more scattered. We have pollution issues in most of the European bigger cities still. Also here you see Ireland is more to the left, but relatively centered, with most of the monitoring stations being below the future limit value, but at least 1 or 2 being above. You see that also we have in Europe only 2% monitoring stations left that are still above the limit value that we have now, and 74% of the monitoring stations record levels above the WHO guidelines. So to address this, the Commission, as part of the European Green Deal in 2019, committed to learn from the experiences made with the implementation of the current legislation, and announced that we would propose to strengthen the provisions on monitoring, modeling, and air quality plans, and we would propose to revise air quality standards to align them more closely with the World Health Organization recommendations. And this is exactly what we did. 2 years ago, a proposal was tabled and adopted by the Commission on the 26th of October 2022, in which we developed on the basis of better regulation principles, meaning that we underpinned the proposal with an extensive impact assessment and stakeholder consultation, a suggestion of how to take the legislation forward. This included a detailed quantitative analysis of different policy options based on the leading air quality models currently, namely GAINS, EMAP, and UEMAP, supported by GEM E3. This included also over 1,000 written replies, several rounds of expert consultations, 2 stakeholder meetings, both of them with more than 400 people each, including, I think, it's fair to say, the input from several of you in the room today. In other words, we listened carefully to evidence and perspectives, and I will limit myself to showing only some of the outcomes of this assessment at the end. But all of the work we've done to do this is publicly available and transparently on our website. And the good news is that since this proposal was put forward, the negotiations between the European Parliament and the Council have concluded, with the Parliament adopting the agreed text in September and the Council having done so on the 14th of October 2024. We now await the publication in the official journal, 20 days after which this directive would enter into force. Which brings the questions, what does this revision actually improve? The first element is that it improves our approach to environment and health. We proposed a zero pollution objective to be met by the year 2050 at the latest. To set us on the trajectory towards this, we had put forward 2030 EU air quality standards. I'll come to those in a second. In other words, for 12 pollutants, we proposed to align them more closely, but not fully, with the WHO recommendations. We also proposed an update of other air pollutant metrics, including an average exposure reduction obligation to complement the sampling point measurements, so that we have a regional reduction enshrined in the directive itself, in this case by 25% over a period of 10 years. It may be useful to explain how these new standards that I'll show you in the next 2 slides were actually arrived at. Laura mentioned before that the World Health Organization in 2021 alerted us to scientific evidence that we had collectively been underestimating the health impacts that occur also at low levels of air pollution. Based on their systematic review, they find that PM2.5, to take this as an example as the lead indicator, to have a quantifiable negative impact at concentrations as low as 5 micrograms per cubic meter. And they suggested this to be the guideline exposure level. The guidelines also recognize that in some regions, these levels may not be achievable in the short term. And therefore, they put forward interim targets, 10, 15, 25, and 35 micrograms. But they're also very clear that these interim targets still carry the risk of significant health impact, and mortality as an indicator here shows that if you do not meet the guideline level, but are at the first interim target at 10, you accept 4% additional mortality. This rises to 8% if you accept 15 micrograms and 16% if you accept 25 micrograms. We have taken these levels as the guiding values for our impact assessment and assessment of different policy options. The current limit value, note, is set at 25. We calculated what the impact would be if we lower this to either 15, 10, or 5 micrograms. And we looked at the other pollutants in a similar manner. We assessed these 3 policy options and identified that each of them would, in the end, render significant health environmental benefits which outweigh the implementation costs by 2030 for all 3 of the options, but to different degrees. So we took into account 5 factors, namely achievability, the costs involved, the benefits to be expected, the benefit to cost ratio, and the expected health benefits. And based on this, concluded that the middle option, the policy option I2 with the 10 microgram PM2.5 would be the one to propose and the one that the co-legislators then also accepted. To break this down into more detailed number, and I don't expect you to go through all the lines in the brief time that I'll show you the slide, to highlight maybe some pollutants and some of the limit values that we see. We have standards for long-term averages for PM2.5, as I mentioned, until 2030. This will continue to be 25 micrograms per cubic meter. As of 2030, it will be 10. All of this compared to a guideline value of 5. We have a similar dimension for PM10. For NO2, we have 40 at the moment, which was the old WHO guideline value. It will be 20 microgram per cubic meter as of 2030 against a WHO guideline level of 10. You will see that for the heavy metals, lead, arsenic, cadmium, and nickel, we have more or less kept the current values, however, changed those to be limit values rather than target values as of 2030, which means they come with additional consequences when they are not met. Similarly, we have revised the short-term standards, introduced a new daily limit value for PM2.5 at 25 microgram per cubic meter, with 18 days of exceedances being accepted as being part of the variation in pollution levels. This is higher than, of course, the WHO has recommended at 15 micrograms with only 3 days of variation, but it introduces a new metric and a new stability for citizens to know that the air quality also on a daily level is not harmful. Similarly, we've introduced levels for NO2 at 50, which is what the WHO also recommended, albeit we leave more room for exceedances for 18 days rather than 3 days. I will not go through the rest of the numbers, but as you will have my slides, you will also have these tables, and of course they are also in the directive itself. In addition to that, of course, the directive also sets alert and information thresholds, and as I said, the average exposure reduction obligation, which I have not captured in the slide. But this is not the only thing that the revision improves. In addition, the directive adds new elements for governance and enforcement, which includes a regular review mechanism of the directive to see if we need to adapt the directive to new scientific findings. We also are making air quality plans more effective and improved the enforceability of air quality plans where limit values are not met. So there are new provisions on access to justice, on compensation and penalties. And there's also more transboundary cooperation or more guidance on transboundary cooperation in the directive. A third dimension is an improved approach to monitoring and assessment. We have strengthened the combination between monitoring and the increased use of air quality modeling. In addition, there is a requirement to add information on the spatial representativeness of sampling points to better inform air quality action. And this also translates into making clearer what monitored data means for areas where there is no sampling point surplus. And for the first time, we will be seeing structurally monitored results for pollutants of emerging concerns, meaning ultrafine particle, black carbon, and ammonia. Again, to translate this into a image, the system of how we assign or design a monitoring and assessment regime has been simplified with a stronger role for modeling and additional needs for monitoring. We, broadly speaking, distinguish three regimes. If you are below the WHO levels, you're on regime 3, and basically modeling or equivalent methods would be sufficient. As soon as you pass that threshold and you have assumptions to do so, you end up at least in regime 2, if not in regime 1, which kicks in if you are actually above the limit values and target values set. The difference between regime 1 and regime 2 is that if you are in regime 1, if you are above the limit value, you will have to have a fixed sampling point system fit according to the directive, which may be supplemented by modeling. Whereas for now, we will be doing a impact assessment, and based on that, the modeling will become, implementing act, and based on this, the modeling will become more mandatory. But this is still to be done. And this modeling will also be needed every 5 years. In addition, on regime 2, you can reduce the amount of monitoring stations if indeed you replace them with a quality assured modeling or indicative measurement system. So we've created a slightly simpler approach, which hopefully gives us more information also within the spatial representativeness domain. A fourth dimension, and it's the final one I'd like to highlight for the directive, is that we improve information and communication by making more up-to-date data information mandatory. It's good that you plowed ahead in Ireland to expand that, as I just heard. Also, we have a requirement for an air quality index or indices to provide hourly information and to also translate information on air quality, make it more accessible and more targeted for a wider public. So what do we expect to achieve if all of this plays out? The first element is that we would see a reduced annual mortality linked to air pollution by more than 50% than we would have without this policy. And that also holds true for morbidity. So we will see that if and when we reach those limit values and the measures have been taken to do so, that we have a significant health benefit. We will see a social benefit as stricter limit values particularly protect sensitive populations and vulnerable groups. And it also hopefully be beneficial to those groups that there will be additional health information available related to air pollution. Third, we expect environmental benefits, including a decline in eutrophication and acidification by 22 and 63% respectively, meaning also less crop losses and less damage to forests. And we do expect a clear economic benefit. According to our calculations, the benefits far outweigh the costs. The annual gross costs we see in 2030 are estimated at 6 billion per year, compared to at least 42 billion and up to 121 billion, again, depending on how you measure the value of life as benefits. So the ratio we have is at least 7:1. I'd like to finish this quick overview with some concluding reflections. The first one, and I think it's important to stress this over and over again, clean air policy works. It's not always easy, but it delivers results. We have seen major improvements in air quality since the 1990s. Secondly, we have an air quality monitoring network and a modeling supplement that is exceptionally robust, and it allows us to give comparable and harmonized information across the EU. This may sound trivial as a conclusion, but it puts us in a position in where we as a society are well informed about air quality in a reliable manner in real time and are able to manage it. The third element that I'd like to stress is the proposed Ambient Air Quality Directive, as I showed in the previous slide, will deliver significant health, social, environmental, and economic benefits when it's adopted, as it is now, when it is entered into force, and most importantly, when it's implemented, and we realize that the work only starts. The fourth element is that, yes, some regions will face more of a challenge than others to reach the current and the future limit values, but also these regions have had striking improvements, and where they will be particularly challenged, there are provisions in the directive to help them further. And finally, the implementation, governance, and communication will be key to bank the benefits, and that requires money, and this money is available. There's EU funding available for clean air that amounts to 147 billion in the time frame of 2021 to 27. So this is money and effort that we can put to good use. Thank you very much.